great to see you, and I wish you every success in the remaining days of your confirmation process. I want to mention two things to you that I've put a lot of work into over time. One is delivery system reform in our healthcare system. Macro, we hit the Medicare Trust Fund in 2024, and so we're going to have to deal with that issue between now and then. Micro, Rhode Island has two of the best accountable care organizations in the country. These are primary care provider groups, doctors' practices that have got together early, signed up as ACOs under the Affordable Care Act, and have changed the way they practice, and as a result, their cost per patient is coming down, their patient satisfaction is through the roof, their outcomes are improving, and they're sending checks back to the federal government out of the shared savings that they've been able to obtain. My staff person will hand you a little graph that I've got a big copy of right here, which is something that I've worked on for a while as time has gone by. In the far left here, time begins around the time we passed Obamacare. And at that point, CBO projected what federal health care spending was going to look like, and their projection then is that top line. But in fact, with Obamacare law, we didn't follow that trajectory. Costs were actually lower. And as we've gone forward, we've experienced actual costs that are that bottom line. And the current projection, matching that original one from 12 years ago, I guess now, pushes out from where we are at now out 10 years. But if you took that same projection and put it onto where we were before, here's this gap between what was predicted and what we've achieved. And in the next 10 years, that gap is $6 trillion. Something changed from what was anticipated at the time we passed Obamacare, and the savings in the next decade are going to be $6 trillion from whatever that thing was that changed. I think that what changed was getting away from fee-for-service, getting providers engaged in accountable care organizations, and the emphasis on quality and reducing medical errors and dealing with patients better. So I've had my rows with the Obama administration over how they were doing ACOs, and I've had my rows with the Trump administration. And I want to work with you to make sure that these organizations that are basically breaking trail for the rest of the healthcare system, these leadership ACOs, are getting the support and the encouragement that they need, because when they win, we win. And with Medicare Trust Fund starting to hit its limit looming, we got to get serious about that. And I don't need a long response from you now, but I want to make sure you're aware of the opportunities for delivery system reform. And I know you've got some very good ACOs in California as well.
Yes. And Senator, if there's a response there, I'm looking forward to working with you on it.
We will, because we got work to do. It's also very likely a big political win-win. I don't know anybody on any side of any aisle in Washington who doesn't want better care, producing lower costs with happier patients. Last point, this is a bit of a personal thing. I've been working for a long time on having us treat people at the end of their lives better than we do. Make sure that their choices are respected, making sure that their capability to be at home at that time is respected, make sure that they're pulled out of the hospital treadmill and they aren't dying in intensive care units that they don't want to be in and shouldn't be in. We've worked with CMMI a lot on that, and I'm hoping that we can close out, under your leadership, through the Center for Medicare and Medicaid Innovation, a pilot program that will show that when you treat people at the end of their lives with more humanity, everybody's happier and it saves money. Will you work with me on that?
As someone who had his father live with him the last 3 years of his life, so that when he passed in his bed in my home, Absolutely. I look forward to working with you on that.
You and I have had the same experience then. Thank you, sir, and Godspeed in your confirmation.
Thank you, Senator.
Thank